Welcome back to your Feel Good Breakfast show. It is a Tuesday morning, but not just any Tuesday morning. Today is World Autism Day, or World Autism Awareness Day, which is recognized annually on the 2nd of April. And this day encourages people from all around the world to take measures to raise awareness about Autism Spectrum Disorder. Now, people worldwide have heard of autism, but might not be aware of the fact that autism actually refers to not only one disorder, but a broad range of conditions that are characterized by challenges with different things like social skills and repetitive behaviours. And here to help us unpack what Autism Spectrum Disorder is, please welcome Autism Technician Philip Viljoen and, of course, our trusted medical professional, Dr. Darren Green. Gentlemen, thank you very much for being here.
Thank you for having me.
On the 2nd of April. All right, so exactly what is or what are Autism Spectrum Disorders?
Yes, I mean, that word, Autism Spectrum Disorder, is a word that's often argued around the world regarding whether anyone on the spectrum of autistic behavior or the condition should actually term it a disorder.
Yes.
When we speak about autism spectrum disorder, we're using criteria from the DSM-5, which is a diagnostic manual that is used worldwide by psychiatrists.
Okay.
And in this case, often in child psychiatry specifically, they use those criteria in assisting with the diagnosis of people along that spectrum.
Yes.
So basically autism involves a clinical picture that has a spectrum of different aspects of behavior and social interaction. So social interaction and social relations to the world and people around you is the first thing that could be impaired, that you could pick up at an early stage. The second thing is language. You have difficulty communicating and expressing your emotions or your feelings, or even just plain old language is difficult. And then limited imagination is another big component, where repetitive games, for example, putting yourself in someone else's shoes becomes really difficult in terms of relating.
Yeah.
And then obviously the last one is the abnormal behaviors, where you could have different things like hand flapping movements, like creating your own words, for example, like repeating what the people around you are saying and just bouncing it off them, perseverating, etc. But the behaviors are vast, and that's why it's called a spectrum, because you could have aspects of these four main areas spread out in different degrees of varying ability.
Yeah, and I think you've probably touched on a few of them already, but if we could broaden out on some of the symptoms, especially say earlier on symptoms of autism spectrum disorders.
Yeah. So when you look at a child with autism, you know, the diagnosis has to happen, or at least the symptoms have to appear before 3 years.
Okay.
That's one important thing. So often what you'll see, you know, what you'll physically see in the child is you'll see that they're not very interested in engaging in social interaction.
Okay.
Now, once again, I have to add the caveat here, or for the first time, I'll do it many times, that every child with autism is very different. That's why they call it a spectrum. Okay. You know, they're not going to interact socially. Maybe they will. Maybe they'll love being touched to such a degree that they actually want to be squeezed. Maybe they don't want to be touched at all. You know? So there's like a kind of hypersensitivity or hyposensitivity going on. Other things you can look at is a lack of eye contact. Like Dr. Darren said, a lack of play skills is a very important one. Often, you know, you get these repetitive behaviors such as flapping. One of the favorites for some reason is the kids love looking at the wheels of a car. So they'll just kind of like spin that wheel. So
hours.
Yeah, exactly. So you're looking at a child who is basically stuck in this little world where they're in a little corner and they're playing with the wheel of their car, and that's their life. You know, and they can't actually communicate their needs. So you end up with behaviors like tantrums. So some children will develop some language and others won't. Okay. It depends on the severity.
Yeah, clearly a lot for us to learn and really unpack and discover, especially on this World Autism Awareness Day, which is recognized every year on the 2nd of April. So we're going to have our lines open, 0214309881. Please give us a call as we learn to understand the autism spectrum disorder. Now, today, the 2nd of April, is World Autism Awareness Day, and so we have joining us Autism Technician Philip Viljoen, as well as our friend in all things medical, Dr. Darren Green, here to help us unpack and understand the spectrum of disorders that are involved in autism as we're learning. We've got a caller on the line from Johannesburg. It is Morris. Good morning, Morris.
Good morning. How are you this morning?
Very well. Thanks for the call. What is your question or comment?
Man, I've got a granddaughter that has, and you say autism comes in different forms. Now, what she does, she doesn't associate with children, even at schools. She doesn't make friends quickly. She's very soft-spoken. She's, even with the cousins at home, she's always wants to be all by herself. Or just sit in front of the TV and watch. She can watch TV for the whole day.
All right. Thank you very much for that. So what do you make of what Morris has just described?
So it is difficult, you know, just from a short sentence to know exactly what's going on with a child.
Yeah.
I think it's very important, especially at an early age, for a parent or the loved ones of that child to kind of notice these things. And definitely if they have got any kind of questions to, as this caller did now, seek some help, seek some information about it.
Yeah.
So, you know, there's nothing strange about a child wanting to watch TV the whole time. But if they're not having, you know, if they're not socially interacting,
yes,
it becomes a problem. And it very well might be, because, you know, you're dealing with a spectrum disorder here, it might be that there's a more mild form of autism going on. Something that they used to refer to as Asperger's, but these days they're actually just calling it all Autism Spectrum Disorder.
Yeah.
Okay. And what that would look like is a lack of kind of social interaction. Lots of language skills, maybe typical language skills, maybe typical academic skills, but the kind of social aspect of it. If you think of Big Bang Theory, Sheldon, he's typical. Yeah, very typical of it. So.
Okay.
So for this caller, my suggestion would be that they need to maybe just go and see for a diagnosis.
Yes.
Go to a psychiatrist, go to a psychologist, and check. Worst case scenario, there is something wrong, and then they can seek treatment. You know, and the younger the child is, the better that treatment is going to actually end up being.
Absolutely. So as soon as possible. I'm glad you actually just mentioned this. So you go and see a psychiatrist or a psychologist. Any one of those two medical professionals can help.
Or an educational psychologist.
Or an educational psychologist can help you to diagnose that. So if I'm a parent and I'm taking my child to one of these professionals, what am I expecting to see and experience during that diagnosis?
I think the big thing is that there's a team involved often that firstly will undertake in an observational capacity.
Yeah.
Often your trusted GP is not well enough versed in terms of this speciality and should know then when to refer early rather than later. But there are dedicated teams that include people like a child psychiatrist in this stage, a psychologist, a speech and language therapist as well, and then an educational, obviously, psychologist as well, that will observe. They'll do different things in terms of play therapy, in terms of interaction, in terms of eliciting social responses from the child. And obviously there are medical things that mimic autism spectrum disorders as well, that also need to be excluded first before getting to the diagnosis of autism. If you think about someone with a hearing disability, for example, their inability to hear interaction and then make eye contact and steer away or to behave in a certain way might also need to be excluded first.
Okay, we're going to continue the conversation on the other side of a short break. 0214309881. Give us a call on this World Autism Awareness Day. All right, today, 2nd of April, World Autism Awareness Day. We are joined by Philip Viljoen, who's case manager and behavioral certified autism technician, as well as Dr. Darren Green, our trusted friend in all things medicine. 021-430-9881 is the number to dial. We have a caller on the line. Good morning, Zola from Joburg.
Morning, how are you?
Very well, thanks for the call. So good to have you with us. What's your question or comment?
Well, I have a question. My daughter is, she is autistic, but she's now a teenager, and we are basically battling to discipline her because we do not know whether the naughtiness that she is going through is it triggered by autism or is it just normal because she's a teenager and she answers back and so on and so forth. And so we're battling. Is there a way of perhaps disciplining her or being able to determine whether it's autism or it's because she is already going through the stage of
I guess
being a teenager?
understanding what's going on right now. Advice, gentlemen.
Yeah, so that's a great question. I think, let me talk about the treatment a little bit, and maybe that can answer the question a bit. So at Star Academy, we do a treatment called Applied Behavioural Analysis, okay, ABA for short. Now, what I would advise to this parent is, when it comes to you know, the kind of naughtiness that you see around children with autism, it's not really naughtiness. What it is you're dealing with skill deficits, okay? You're dealing with a child that is incapable of interacting with their environment in a meaningful way. Okay? They're incapable of getting a lot of the things that they need to actually, you know, they can't communicate that. Even if she's got words, it's often very difficult for her to make the connection between, you know, what I need and how to access it. Or even, I'm hurt, my stomach is sore, or something like that. How do I communicate that, and what do I do about it? At the same time, because they're lacking certain kind of prerequisite skills, you know, when it comes to your kind of language and your social, it becomes very hard as you get older, especially to understand the world and to interact with the world in a functional way. So my recommendation to those parents would be that they should definitely look at getting some kind of intervention in. Even if they get somebody to actually come and work with them as the parent. So at Star Academy, what we often do is we do a kind of unit approach where we've got the parents on a team, we've got the teachers for that child on the team, we've got the OT, whoever, and we all kind of work together on how, you know, for the best interest of the child.
And parenting in itself, even without being on the spectrum of autistic disorder, you can imagine just choosing what disciplining style to use for your child's different temperament or personality in itself is a challenge.
Absolutely.
So definitely working with the parents would also be right at the top of the list.
And at your organization, Philip, do you order or do you offer as wide a spectrum of treatments as there are disorders?
Absolutely, absolutely. It's very important. It's one of the core principles of ABA is that I'm not there treating a disorder. I'm actually, to a great degree, not interested in what the disorder is. I'm interested in what the child. So for me, it's very important that I look at what skills the child is missing and what deficits. Also deficits and the behavioral excesses.
I see the dogs have come and joined the conversation as well. I also want to talk about what are some of the success stories you've seen, you know, after treatment, what are improvements you've seen and what effect that has on the child and the parents?
ABA is very, very effective. It's also very intensive. It takes a lot of time. So some of the success that I have seen, I've seen children that at the age of 3 were not capable of speaking. They, you know, after about 3 years of therapy, it doesn't happen with every child, but a lot of them actually have developed the capability of having verbal speech. Okay, so being able to communicate their needs. That's a big one. Other children that haven't necessarily been able to achieve that, we've given them a form of communication. We've given them pictures. We've given them a iPad where they can push buttons and they can actually communicate what they need. That's always the biggest kind of success story for me, is when you teach a child to communicate with their world, all of a sudden they're not stuck anymore, but they're actually out there and communicating with people.
In understanding this a bit more, is there something that parents can do to help to not get there? I'm trying to find out the causes,
in terms
the susceptibility. I found out, for instance, that boys are more likely to develop.
The ratio is 4-to-1 actually for the autism spectrum disorders. So boys are 4 times more likely than girls to develop it. And I mean, looking at an overall incidence of about 1 in 100 children that could be on that spectrum. So that's quite it's quite considerable. Remember, the degrees obviously can vary. And they're often associated syndromes with the autistic spectrum disorders, medical conditions like Tourette's, Rett syndrome, for example, epilepsy and seizures often. So you would find then obviously that spectrum of behavioral change with those medical conditions sometimes as well.
Yeah. All right. Well, gentlemen, thank you very much. That's all the time that we have, unfortunately, but learned so much from you. And thank you also to our callers for your insightful questions and sharing with us. I think you can feel free to engage with Dr. Darren Green and Philip Viljoen online on social media. That's their handles, at Dr. Darren Green, at Philip Viljoen, as we continue to learn more on this World Autism Awareness Day.